Hello and welcome to Evidence Mastery. I'm your host, Dr. Massoud Toussi. So glad you could join me. Today, we're going to break down a really important guidance document, one that's all about setting the standard for high-quality research in pharmacoepidemiology. All right, so what we're looking at is the Record P statement. And yes, it's a bit of an acronym soup. It stands for the Reporting of Studies Conducted Using Observational, Routinely Collected Health Data for Pharmacoepidemiology. It's a mouthful, I know, but its purpose is actually super clear and incredibly important. Okay, before we jump in, just a quick but really important heads up. What we're doing here is a summary, kind of like the highlight reel to get you up to speed. For all the nitty-gritty details, you absolutely have to go read the full guidance yourself. That's the real source of truth. So, here's what we've got on tap. First, we'll talk about why we even need better reporting. Then, I'll introduce you to the Record P checklist itself. We'll dive deep into the methods, specifically study design, participants, and defining drug exposure. We'll also touch on the discussion and interpretation section, and then we'll wrap it all up with the key takeaways. Sound good? Let's get started. All right, first up, the need for better reporting. Let's really get into why this all matters. You know, we have access to this incredible treasure trove of data. Routinely collected health data from electronic health records, insurance claims, you name it. It's a powerful tool for research. But it begs the question, are we actually reporting these studies effectively? And the honest answer? Well, often the reporting just isn't up to snuff. Key details get left out. And when that happens, it makes it almost impossible for other scientists to replicate the study. It also means we, as readers, can't fully understand a study's real strengths and weaknesses. And at the end of the day, that just creates a ton of waste in biomedical research. So, this is the exact problem that the Record P checklist was designed to tackle. It's a clearer framework for everyone to follow. And this wasn't just created out of thin air. It builds on some really solid foundations. You start with STROBE, which is the gold standard for observational studies. Then you've got RECORD, which adds guidance specifically for that routinely collected data we just talked about. And finally, RECORD PE extends all of that for the unique challenges you find in pharmacoepidemiology. Okay, let's get practical. How does this actually work? We're diving into the methods section now, which is really the foundation of any good study. And right away, we hit something super useful in item 4B, visualize your study design. The guideline strongly recommends using a diagram. Think about it. It's so much easier to understand complex timelines with exposure periods, washout periods, and observation windows when you can see it laid out visually. Speaking of which, what exactly is a washout period? It's a really key concept. It's that specific amount of time before you classify a patient as a new user of a drug. Why is that so important? Well, it ensures you're actually looking at someone starting a new treatment, not just someone restarting an old one. It prevents a whole lot of confusion and potential errors. And the guideline doesn't stop there. When it comes to your study population, you have to be incredibly specific. Item 6.1.a says you need to describe not just what the entry criteria are, but the precise order you applied them in. Seriously, it matters if you excluded people based on age first or based on their specific condition first. That level of detail is what makes a study truly reproducible. Okay, now we're getting to what is probably the biggest, most crucial part of Record P, and that's all about defining and reporting drug exposure. And this is a big one. It's not just a single point. It's a whole collection of items. You have to explain how you developed the exposure definition, which data sources you used, the exact time window, how you attributed events to that exposure, and you even have to justify your comparator groups. The level of precision here is just absolutely critical. Let's zoom in on one of those, the exposure time window. It is not good enough to just say a patient was exposed. For how long? Was it the 30 days after they filled a prescription? Did you account for gaps between refills? The guideline says you have to define this window with total clarity and, just as importantly, explain why you chose that specific window. And that connects directly to the next point, risk attribution. So if a patient has an adverse event, should we link it to the drug they're taking right now? Or could it be because of their cumulative exposure over the past 5 years? The answer depends on the biology and the research question, and authors have to be crystal clear about which model they used and why. Now, if you do a great job reporting your methods, it sets you up perfectly for the next step, having a transparent discussion about potential biases. And in pharmacoepidemiology, there are a couple of big ones you always have to think about. First, there's confounding by indication. This is where doctors tend to give a certain drug to sicker patients, which can make it look like the drug is causing bad outcomes when it's really the underlying illness. Then you've got the healthy adherer or sick stopper effect. Basically, people who take their meds perfectly might just be healthier in general, while those who stop might be doing so because they're getting sicker. This brings us back to why choosing your comparator group is so important. And I'm going to quote the guideline directly here because it puts it perfectly. Clear description of the use and justification of comparator groups is needed for the assessment of the potential for confounding by indication or severity. It's one of the most critical decisions a researcher makes, period. All right, let's step back and pull this all together. What are the key things you really need to take away from our look at the Record P guideline? Really, at its heart, Record P is all about transparency and clarity. By giving researchers this clear roadmap of what to report, it makes it possible for others to reproduce their work, and it lets all of us, clinicians, regulators, other researchers, properly judge how valid a study is. And that kind of rigor, that's not just about better science. Ultimately, it leads to better patient care and better public health. And that wraps up our explainer on the Record P statement. Thank you so much for joining me today here on Evidence Mastery. You know, if you find these kinds of deep dives into research methods and guidelines helpful, you might be interested in a book I have in the works. It's called Real-World Evidence Tools and Templates. It's really designed to be a comprehensive guide for everyone working in this space, and it'll be available on Amazon.com in 2027. Thanks again for watching.